Hi everyone. Okay, I want to speak about high blood pressure. This is a big critical piece to PCOS as well when you go to the doctor, and I have to say about the doctors. Whenever they see a woman who is a bit overweight and or overweight in the sphere of how society calls overweight, I have issues around that. They immediately think, "Oh, easy job, easy appointment." Blame it on the weight and tell them to lose the weight and everything will be fine. So I have a couple of points to this video. First is definitely keep monitoring your blood pressure, because if you have PCOS, you most likely have have symptoms based on stress, cortisol levels, hormone imbalance, obviously, which also affects your blood pressure. So make sure you're monitoring your blood pressure as often as you can to see where it's at, because that definitely huge part to the health. That being said, let's say you were like me. I was 30 and I went into the doctor's office, and first thing he said to me was lose weight. And I said I have PCOS. It's kind of hard to do. He didn't understand. In any case, he checks my blood pressure. He's like, you're in hypertension mode, and you're only 30. You have to lose weight. And I'm thinking in my head, I get what you're saying, but why do you? In my head, I'm thinking, I didn't say it to him because of course I'm intimidation. I'm only 30. I'm just feeling insecure already because the body shifted within 2 years. So here I was, at 28, having ballooned, not knowing what happened. In any case, when the solution is always like lose weight, and not really recognizing that it's much more complicated than that. So while that's being said, blood pressure is important to monitor, and it's more for me personally about your stress levels, big time. PCOS, as the videos have been coming up, is linked to the brain, and we have to take into consideration trauma, stress, experiences, and what you've gone through, including malnutrition, whatever it is, it ties to the brain. Okay, so blood pressure. I was able to reduce my blood pressure being overweight still, because I was reducing my stress levels with essential oils like lavender and smelling them every day. I would come after work, and it became this ritual, because once I found out that I had high blood pressure, I was still trying to lose weight, but it wasn't my priority anymore. It was more about relaxation and trying to walk. It was in about anything else. Now I was like, okay, if I have high blood pressure and my family has heart disease and people have, had strokes and all that, I'm kind of worried now, and I'm only 30. So as I'm going along and progressing along, what I did was lavender oil and lying down and smelling that after work, putting on Zen music and just releasing all the tension from the day for at least 15 to 20 minutes. Sometimes I would take a nap up to 1 hour if I could. If I couldn't, 15 to 20 minutes just in that zone, it worked miracles. And of course, the exercise. So again, at that time too, I wasn't doing a lot. I was just kind of walking and stuff like that. The weight part, maybe I lost 5-6 pounds, but next time I went back to the doctor, my hypertension issue was gone. So as you elevate and change your ways of eating, change your dynamic and all those things, keeping in tune with your blood pressure is important. I didn't go on medication. He said I was at hypertension. I said, I'm going to work on this myself and figure it out. So I've never taken hypertension medication, and I still monitor as much as I can when I, checking my blood pressure, because emotions drive my blood pressure. So when I have, and I think that's for everyone, when I'm having a bad day, or I'm like social media fighting on Facebook with somebody about a topic, boy, my blood pressure goes through the roof, and I know that's unhealthy because I start getting a headache. So this is where you need to be delicate with yourself when it comes to the blood pressure issue. Going back now, I have to also have a word of caution. If you are in a medical situation and are in a medical situation where you need medication, that's fine. If you feel that's the best route for you, that's fine. I'm just sharing my experience in terms of the limitation the doctors have at times for the insight when it comes to PCOS, and how they keep blanketing the problem and also blaming the problem on the weight. The weight, I'm going to share a study, is still a controversial issue, because I'm sure, as you know and as I know, there are thin people walking around that their blood pressure is through the roof. So they can't tell me that is because of, what do you call it? They can't, then how do they explain that their high blood pressure compared to my high blood pressure? And I also know women who are obese and are healthier than the thin people. So that's what I'm trying to say, is that I don't think medicine has really caught up with the complexities of the human body and genetic codes, and also especially with PCOS. So this is just kind of like maybe a rant or whatever, but I was thinking in my head because I had an appointment finally, and I went, and as usual, the lack of understanding around PCOS is a common frustrating thing for me. I think I'm going to start printing out studies and taking it with me. In any case, check my blood pressure. Blood pressure was fine, and yeah, and according to the BMI index and all that, I am overweight and I'm fine. So it's just, I'm just saying that when I was like in my between 235 to 245 range, I was able to balance out my high blood pressure through stress reduction and some exercise, dancing, walking, whatever it is. Anything for stress reduction helped me a lot. And as I'm saying, emotional things do inflate it does increase my blood pressure. So blood pressure symptoms are headaches, fogginess at times, dizziness, vision disruption. So those kind of things can, affect you if you have high blood pressure, and do monitor it. But again, do what you can, but I'm just kind of sharing, okay? So just take whatever you can that benefits you. If it doesn't benefit you, whatever doesn't benefit you, don't take it. Don't listen to it. Okay, thought I'd share. I'm off for a walk. Take care. Bye.